and welcome back to Good Morning Mississippi. I'm here now with Dr. Craig Clark. He is a neurosurgeon, which before the break I was just in awe of that fact. That is so amazing. And you are here to talk about an event that's happening in Greenville. It's coming up this, what is the date of it?
It's tomorrow.
It's tomorrow, this Wednesday, tomorrow, right in Greenville. What's going on?
Basically, it's a community awareness program, and we're trying to call attention to the diagnosis of sacroiliitis, which is, you know, for many years, if it wasn't a disc problem, we didn't have much to offer patients.
Okay.
And so now there's realization and new treatments that probably 25% of patients who have back pain, it's not really discogenic or it's not really spine pain.
Okay.
But it's pain from the joint, the sacroiliac joint. And now we have a new treatment for that.
It's the sacroiliac joint. So that's something we all have. Where is that located?
That's the joint between the tailbone and the pelvis.
Okay. And that's connected to neuroscience because it's just part of your spine. Is
Correct.
that right?
That's right.
And so what would be some of the symptoms of this pain if people at home kind of want to think maybe this would apply? What are some of the symptoms?
Well, primarily low back pain.
Lower back pain. And
it can also cause leg pain.
Lower back pain and leg pain. And previously you were saying it would be just a disc. You'd assume it was a disc out of place, and then you go in and it wouldn't be that or whatever, and then all of a sudden people are like, what?
Well, it wasn't the concentration of what was treated because we didn't have much to offer.
Mm-hmm.
And so now there are new treatments for the SI joint, and so now it's drawing more attention. And you know, if you don't look for something, you never find it. So,
exactly.
yeah.
So what are those treatments like? Are they very complicated, or can we say them in layman's terms by any means?
Oh, well, you know, first you do everything but surgery first.
Mm-hmm.
You know, there's bracing, there's injections, there's oral medication, those
Mm-hmm.
things, physical therapy, even chiropractic manipulation if that works.
Mm-hmm.
And if all those other things fail and we are certain that the joint is the cause of the pain, then we can entertain a procedure where we actually fuse or arthrodese the joint. In other words, stop motion across the joint.
And that would then reduce that pain in people.
Correct. Yes.
And are there age range or demographics that are more at risk of this type of pain, or is it sort of across the spectrum people have this?
Well, it's actually, it's going to be more common in older people,
Mm-hmm.
particularly people who have in years past had a lumbar fusion performed.
Okay. Well, this is all interesting stuff, and I'm still so amazed by your area of expertise, neuroscience. I mean, you said I could come and check it out?
Sure.
I don't think you'd want me in the operating room. It's like a, you know, what is it, a bullet in a China, what is it, China store?
Bull in a China shop.
Yeah, I would not want me anywhere near surgery. I'm just saying. Okay, I'll let you do that. Maybe I'll look at some pictures. But we have the event that was on the screen before, and also we have a phone number that we need to tell you all because you want people to RSVP before this event tomorrow.
Please, it will help us to make proper arrangements.
And do we have that number? Do you know the number? Do we know
I
the
don't.
number? We were supposed to get on the screen. Oh wait, we have the number upstairs. We'll have to give that number because I see if we pull up the events, we've got all the information. We'll get the number for you guys because we have it upstairs. We'll get it added to the screen for y'all. But we thank you so much for coming on, and can keep doing the great work that you do and make people's lives easier when you get rid of that pain for them. We appreciate it.
Thank you. It's
Thank
very nice.
you.
My pleasure.
We'll be right back.